and welcome. My name is Elsa Marie Collins, and I'm one of the co-founders of Poderistas. And this month, for Latinx Heritage Month, we are having this really important conversation between myself, Diana Maria Riva, an actress, and Dr. Nadine Burke Harris, who is the California Surgeon General. This month, we are really focused on helping to encourage all eligible Californians to get vaccinated against COVID-19. And in honor of Hispanic and Latinx Heritage Month, the state of California has partnered with Poderistas to produce a PSA and this conversation to highlight the critical benefits of COVID-19 vaccines. Our communities have been hit especially hard by COVID-19. We comprise nearly 54% of cases and about 46% of COVID-19 related deaths in California. Our vaccination rates are improving, with slightly more than 51% of eligible Latino population statewide being fully vaccinated, but there is more we can all do. So how can we make a difference? It's important to remember and share with those we love that vaccinations are safe and effective and are proven to prevent serious illness, hospitalization, and death, and help reduce the spread of COVID-19. Even in the unlikely case that you do get infected, the vaccine offers strong protection against severe illness. As women, mothers, daughters, sisters, grandmothers, tías, abuelas, primas, we hold an important role in our family's health and healthcare choice. From the smallest unit of the family to the broader society, Latinas value community. Community is an extremely important part of our culture. It's all about coming together to improve the lives of our familias. We need to feel empowered to protect our families, friends, la comunidad, by reminding them that getting vaccinated is the most important action we can take. I know for myself, as a mother of 3 young children, one who is age eligible to be vaccinated, she's vaccinated, and I am waiting for my younger 2 to be able to be vaccinated because I feel that it's going to make them safer. It's going to make our household safer. You know, my mother lives with us, their abuela, and she's vaccinated, and I want to make sure that we're protecting everyone in my house. So I just wanted to highlight that personal little story before we get into this conversation. And before I turn it over to Dr. Burke Harris, I just wanted to address that, yes, misinformation that has spread during the pandemic is causing causes of avoidable illness and death. By sharing facts about the vaccines, we are taking care of our families and communities. This is why we're here today, to talk about the facts about COVID-19 and the importance of protecting our families, our friends, and la comunidad against this virus. So I would love to introduce one of our special guests, the California Surgeon General, Dr. Nadine Burke Harris, who's going to talk a little bit about some of the important facts that we should know about COVID-19.
Thank you so much, Elsa. And it feels super special to be here, particularly during Hispanic Heritage Month. And I want to just start by saying what you just said about misinformation is so true. I think one of the most dangerous factors right now is a lot of misinformation that is going around about the effects of the vaccine, all different things that could happen to you. And really, for me as California's doctor, I am, my big job is to make sure that Californians have the information that we need to keep ourselves, to keep our families, and to keep our communities safe. And so a couple of things that I just wanted to start by sharing is really, number one, about the Delta variant. It is so contagious. It's as much as twice as contagious as the previous variants of COVID-19. And so what we're seeing is that the rates of infection have surged to the point of, where they were the first summer of the pandemic, right? And, fortunately here in California, we have one of the highest vaccination rates in the nation. And as a result of that, we also have one of the lowest case rates in the nation. So literally what we're seeing when we look at places like Texas, when we look at places like Florida, you know, what we're seeing is that the rate of spread of COVID in the community is directly related to how many unvaccinated people there are, right? And so, and we know that when we are talking about the community, the people who we're interacting with, there are people, right? They're exactly what you're talking about. Our tias and our abuelas and members of our family. These are the people who are most likely to be sick if we encounter someone with COVID-19. And I think particularly in California, where we have seen really disproportionate rates of infection, hospitalization, and death among nuestra comunidad Latina, that is something that for me as Surgeon General, it feels really, really important to make sure that we have the information, that everyone is armed with this information to make sure that they can keep themselves and their families and their communities safe.
That's amazing. I want to invite Diana, who is one of our most amazing supporters at Poderistas, who right now is about to shoot a show, but wanted to join this conversation to talk about her COVID experience and really help use that to help our community. So Diana, I'd love to invite you to share.
Oh, thank you. Hi, everyone, and thank you for having me, especially now in this time when there's so much information going out, and I'm grateful to share my story, which was not an easy one. I had shared with Elsa that I got COVID in December, this past December. So we were like month 10, 11 into us knowing about COVID. For all intents and purposes, I didn't think I would get it as bad as I did. And I got it meaning I was very healthy. I was very careful. I worked out all the time. I was a weightlifter, cardio. I'm type O negative. I never get the flu. I never get a cold. And that didn't make me assume that it wouldn't happen to me. I'm just saying that when I got it, I thought, well, it won't be too bad. Hope, my body will act the way it always does when the flu and colds are going around. That is not what happened. I was at my parents', and they live out in the countryside. I was at my parents' house with my children. This was right a few days before Christmas. The first symptom that I felt was a little flushed, and I knew that was weird for me. So I isolated myself in the attic immediately until I could go drive into town and get a test the next day. And both tests, PCR and rapid, said it was positive. The next 12 days were horrible. I was in this attic over all the holidays. I knew I had exposed myself to my family. So now I have a 71-year-old father and a 72-year-old mother that I was very nervous about, and my 19-year-old son and my 16-year-old daughter, and my sister who had been visiting. I was all the symptoms. I was bedridden for those 12 days. I was on the phone constantly with my doctor. My family went and was tested. My father tested negative with no symptoms. My mother tested positive with a runny nose. My son tested positive with 1 day of a metallic taste. And my daughter tested negative. However, there was a day there that she was achy, but seemingly not. But I was, in comparison to them, I was positive, and I was like an 8, 10 being in the hospital. I was an 8. By day 12, I had been fever-free for 2 days. I still didn't feel great, a lot of other symptoms, but my doctor said that because I had been fever-free, it had been 12 days and fever-free for 2 days, I could go downstairs and join the family. Went downstairs to join the family and just sat there really in their company. And by the end of that day, I had to suddenly develop breathing problems. And by the next day, my mother sat by my bed, making sure that I was breathing all night. And the next morning, my doctor said, I need you to go to an emergency room. I don't know if you have a blood clot. I don't know if this is progressing. And I thought, I already did my 12 days. I don't have asthma. I don't smoke. I don't do drugs. I don't have pre-existing conditions. I don't have an autoimmune disease. I don't get colds. All the things I was saying in my head, what is happening to my body? Why is this happening? Thank God my parents were okay, but it did nothing to them. It did it to me. It did nothing to my daughter. It did to my son. When we pulled my son and my daughter, and this is the thing that I want to share. I have not spoken about this to the public because I get so nervous. When my son and daughter drove me to the emergency room, remember, this was month 10, 11 of COVID. So we've already heard all the news, right? And we've heard that when you go into the hospital, you don't come out. That's all I could hear. So when we pulled up to the emergency room doors and I see those doors there, I could not get out of my car because I was afraid that the minute I walked through those glass doors, I would not see these two humans again, because that's all you heard. I was paralyzed and I could not get out of the car. And my son just put his hand on me and said, Mom. And without thinking, I'm a single parent, without thinking, I just blurted out, all my life is going through me. I blurted out to my son, you have custody of your sister. And he just said, stop. And I was now here's a little relief. My very Latina daughter said, no, come on, get out. She says, and she got me out of the car. She says, you're gonna go in there, you're gonna get tested, you're gonna see what's going on. We're gonna go get some carryout. We're gonna eat it right here in the parking lot. And we're not leaving until you come out. So let's go. It's cold. And I was like, okay. And I went in. I had the most amazing care from these nurses, these doctors. They did a CT scan and I had the pneumonia in both lungs, COVID pneumonia in both lungs. Now, mind you, up in this attic, there was a staircase that was enclosed in the attic. And every day I would get up and I would do 10 rounds on the stairs just to keep my lungs going. Even though I had been doing cardio for my entire life, I still got pneumonia. There's nothing they can do for viral pneumonia. So I was told I needed to go back home and just pray for the best. And I did. At that point, I'd been there so long, I was moved in basically with my parents. My mother would take me outside. Every time the sun would peek out, she's like, let's go. She bundled me up and I was the frail person and she was holding me as we walked through the property for about 7-8 minutes. I came out of it alive. I came out of it fully recovered. This is now where I recognize my body. That strength that I said I had, that constitution that I had, I feel now in my recovery. But that is what made me run to get a vaccine. I believe in vaccines. I believe in science. I believe in our medical professionals. And when my doctor says to me, trust this, I believe him. If I question anyone else, I believe him. And all I knew at the end of the day was I would rather gamble with the vaccine than I would with a virus that has no science to it, has no predictability, will choose who and when and what and how. Your 72-year-old mother will get a runny nose. You're going to be in bed for 12 days with pneumonia. And then worse, of course, we've heard. So that fear of never seeing my children again was enough for me to say, I'm listening. What do you want? What else do you want me to know? I was already listening, but I'll listen to whatever else you need to know that makes sense to me. My doctor makes sense to me. Science makes sense to me. And that's why I'm here, not taking any chances.
Thank you so much for sharing that story and
Thank you
for being so open and vulnerable. I know it can be so scary, and I can't even imagine what that must have felt like. I know for myself personally, as soon as my age group was eligible to be vaccinated, I was really excited to go get the vaccine. And as I said earlier, 3 kids, 13, 11, and 9. The day that the vaccine became available for 12-year-olds, I took my daughter and we were, first in line, I want to say. And it just gives me such a sense of relief to know that I'm doing the most that I can to protect my family, my mother, my children, my husband's family, his parents. And that is, sort of the goal of the vaccines is to really give you the most protection that you can have. Of course, we know that nothing is 100%, but what we do know, and what I'm sure Dr. Harris, and I'd love to hear a little bit about, what you have to say about, how the vaccines are upping what we have in our toolbox, as we like to say, or as I like to say, in my toolbox, I have my mask, I have my vaccine, I have being outdoors when it's possible. But I definitely know that when I know that I have the vaccine and my kids, and hopefully in a couple of weeks, my younger two will be able to get them. And I feel very comfortable and confident in having my younger two be vaccinated as well, that I'm doing the most that I can to really protect not just myself, but also people I'm interacting with at the grocery store, at a basketball game, in the street, in our schools. So Dr. Harris, I'd love to hear you talk a little bit about really the importance of being vaccinated and how it does help our community be safer.
Yeah, I just have to say thank you so much for sharing that story. I feel like in my position, unfortunately, I hear that, I've heard that story over and over and over again. And in California, we've lost over 65,000 Californians who did not make it back home to their children. And that just kills me. That's just what tears me up. And to know that the vaccine can prevent that. Folks who are not vaccinated are 8 times as likely to get infected with COVID. They're 13 times as likely to be hospitalized and 15 times as likely to die, right? And we can get that protection by simply getting the vaccine. And what we know, and you said it earlier, Elsa, that vaccines are safe and effective. For us, it was really important when we got down to that eligibility for them to be vaccinated. And that's my own children. And it's the same thing. Like when we've seen the data now from Pfizer, they're reporting that their vaccines are safe and effective for kids who are 5 to 11 years old. And of course, the CDC and the FDA is going to do very, very rigorous evaluation of all of this data. And on top of all of that, right, California has our own independent scientific council. It's actually California in partnership with several other states. So it's the Western States Scientific Advisory Council that reviews all of the science and comes up with an independent recommendation. And that process, having seen the data, having spoken with the scientists, some of the teams at the CDC and the FDA, the thing for me is that when we look at the hundreds of millions of folks across the United States and around the world who have received the vaccine, we really do see that these vaccines are safe and they save lives.
Yeah, and I wanted to talk a little bit specifically about California, and then I know Diana has a question for you, but just speaking of our children, what are California schools doing to keep our children safe as they return to in-person learning? I know all of us were, Zoom school was really hard for some people, and, having connectivity and Wi-Fi, and not everyone was having the same access. So being able to return to schooling in person was so important, and to do it safely and to have it, continue uninterrupted. So can you talk a little bit about what California is doing in order to make sure that we can continue in-person learning safely?
Oh my goodness, so much. So California has invested huge amounts of money, about $25 billion, to ensure that our kids can return to in-person learning that is safe. So it starts with some of the stuff that you might even not think about. We've invested so much money since the start of the pandemic in ventilation systems for our schools to improve the ventilation, right? So that the air doesn't circulate. We have, increased the the cleaning and disinfecting and making sure that all the schools know the protocol for cleaning and disinfecting. We have personal protective equipment, that PPE that people have talked about, for our educators and all the people in the school staff and on the school site. And for example, if a child comes to school and they've forgotten their mask, right, we've made that available so that everyone can have personal protective equipment. We have invested in COVID-19 testing for our for school sites. So I will tell you, my 5-year-old started his first day of kindergarten, and 3 weeks into kindergarten, there was someone who had a rapid test in his class that came back positive. And they told us where to go. They told us when we could go. We could easily go and get tested very, very quickly. And it turned out that that one child who had had the positive rapid test, the PCR came back negative, and so everyone could get back to school. But that infrastructure so that we can do testing and contact tracing and all of that stuff, really important. The other thing that California has invested in is additional teachers, staff, and counselors, because the COVID-19 pandemic isn't just a threat to our kids' physical health, but it's also really stressful. It also has an impact on our mental and emotional well-being. And so investing in more educators to help with that process, and then also investing in supports for our kids so that they can have that support to make it through that challenging time, is what California has been investing in.
That is, I mean, all those things are encouraging. And to know, like, I didn't know about the independent counsel here in California. So that's just like, it's like you have an extra protection there of check and balance. So it's good to know. The other question that came to mind too, that is just, to kind of combat what we're hearing out there sometimes, is we know some people in our community have doubts. So how do we know that the vaccine is safe? What is it that we can share?
That's a great question. And so one of the things I want to let people know is, how does the CDC and the FDA get information about whether or not there are side effects, right? There's, we have hundreds of millions of people getting vaccinated. So how do we absolutely make sure that the vaccines are safe? So before I was Surgeon General, my background is as a pediatrician, actually. And one of the things that we learn in our regular training as pediatricians, because pediatricians give a lot of vaccines, is about a system called the Vaccine Adverse Events Reporting System. It has been in place for many, 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 many years. We're all trained on how to use it. And it essentially says, if anyone has an adverse reaction, like a negative reaction because of a vaccine, there's actually a system where doctors can go and input that information. They write which vaccine, which lot number, which batch number it came from, like all of this stuff, who it was given to, what is their medical history, what was the reaction, all of this stuff. And all of that information goes to the CDC and the FDA, where they're constantly reviewing it to look and see if there's any association with adverse events with vaccines. So that special reporting system, and you can imagine, one of the things that I hear not infrequently is, oh, I did my own research on the vaccines, and so I decided, X, Y, and Z. And one of the things I think is really important is that when we're talking about the research that is done to evaluate the safety of the vaccines, we're literally talking about the CDC and the FDA gathering information from hundreds of millions of people. It's literally more research than any human being could ever do on their own, right? Like, this is what these institutions are for. But the other thing that I want to talk about, that's another system that's really important, is something called vSafe. So if you go online and Google vSafe, or if you go to the CDC website and, click on vaccines and then click on vSafe, that's actually a site. And this is something I encourage everyone to do, is that when you get your vaccine, you can go to the vSafe website and put in your name and your information and say how the vaccine, what the impact was with you, right? So if you say, oh, I had the vaccine and I noticed 2 days later I had a headache, right? Everyone who puts that into vSafe, the CDC and the FDA get that information, and then they start investigating and working with doctors. Or if someone says, hey, I got the vaccine and then I got a tax bill that was twice what I thought it was going to be, right? Because you see some people will be like, oh, I got the vaccine and then I got gum stuck to my shoe. And you're like, I don't think those are associated, right? So this is why we do this process of saying, okay, which of these things that happened around the time of the vaccine, which of these are actually caused by the vaccine, and which of these things maybe are just a coincidence, right? And so that science is happening every day. And that is what the CDC, the FDA, and then also the, California and the Western State Scientific Advisory Council, this is the data that we use to ensure safety for the public.
Those are the things that we can participate in this as well as individuals by giving that information, like it's all there. But I think the one thing that I'm learning, we're learning a lot about the history of vaccines in this entire journey, and hearing that, some of the vaccines that we've been taking since, that we got as little children were not as whatever, the research was not the same. It's just, this is so transparent that this has been presented. So like they're letting us know every single little fact that comes up, even before it can be confirmed. They're saying, we're seeing a little sign of this, it's not confirmed what, and then they're on it. We're getting more information than we've ever gotten before in our lives about a vaccine.
That's right. So I think many people will remember when the Johnson & Johnson vaccine was paused back in the spring. And in that situation, not only did the CDC and the FDA look at all of the data that came, there were literally 15 cases out of 7 million people. I just want to say this, 15 cases. But what was interesting about it was that not only were we looking at the data from the CDC and the FDA, but the CDC and the FDA, they talked to the European Medical Association. They talked to the governing, the vaccine data folks from Europe, and our European counterparts sent us information saying, hey, we're seeing this safety signal. You guys need to look at it and see and do an early warning system to understand if there is a risk here. And that is what caused a nationwide pause. And then the CDC did a deep dive into the science to say, hey, is this vaccine safe to use broadly for the entire public? And they came back, looked at all the data. They said, yes, it is. But what's even more than that, they looked at all the data. Anybody who wants to see how they evaluated that data, they could watch the proceedings. So I don't know about you guys, maybe I'm the only one who was glued to my computer watching all the scientists at the CDC talk about the risk and the benefits and all the stuff and the different science and what exactly the case was and all that stuff. I find it fascinating, so I'm glued to that stuff. But it's available for anyone who wants to see it. It truly is a very transparent process, because you have to understand, we're in a pandemic, right? And so, and this, our COVID-19 vaccines are the key to ending this pandemic. But in order for that to happen, we need to be transparent to make sure that people can trust what we're saying, that they can look at the science, anybody can ask any questions that they want. That's what we want to have happen, because we want the public to really be able to see and have trust in the process.
Yeah, there's one thing I want to address before we kind of wrap up this conversation, because it's really happening in real time, and that's the question about boosters. And so I know that there's been a lot of news about boosters and when can you get a booster? Does everybody need a booster? And so what do we know about the boosters, Dr. Burke Harris?
So this is hot off the presses. Like I literally just had a meeting about this morning because the CDC actually just came out with their recommendation on this. So the boosters are recommended for folks who are at high risk. Okay, so that's folks who are over 65 years old, folks who live in long-term care facilities, or those who are 18 to 65 who have an underlying medical condition that puts them at high risk for severe disease from COVID-19, right? For the rest of us, boosters are not indicated at this time. And again, what the CDC and the FDA are looking at, they're gathering all the data. They're actually looking at, for example, blood samples to look at our immunity. And one of the things that we see is that, especially for folks who have a low immune system, right? If they get the regular course of the COVID-19 vaccines, they're less likely to have the full immune response that someone who doesn't have a weak immune system would have. And so that's part of the reason they get a booster. But this is literally just this morning, hot off the presses recommendation, that those who are high risk, the rest of us who are not high risk, sit tight, okay? So I know one of the things that's so frustrating, it's like, oh my gosh, it seems like the rules are changing, all the time from month to month. First you say this, then you say this. And I want to acknowledge and say, like, it's kind of right. The way that this works is since this pandemic began, we're constantly gathering data, and we're looking at data from research that's happening all over the world. Researchers from many different countries are sharing information. And as we get more information, more science, more data, we update our recommendations. And so now the newest update, so I want to say, I want people to start like getting comfortable with like, okay, it's like the iPhone, right? Like you start with the iPhone 1 and then you get to the iPhone 2. Now you got an iPhone 12, right? At the end of, in a little while, we'll be at the COVID response. That's like, 13X, right? It'll be the most updated version. And every time it gets better, right? Because we have more data, more science.
Yeah, and I just wanted to acknowledge both of you being here and having this type of conversation, and also thank Dr. Burke Harris and the state of California for doing, what you guys have been doing to keep us safe. I know I've had occasion to travel in the last 2 years, and every time I come home, I think, yeah, I feel so lucky to live in California, and in a place where I feel that we're really trying to do our best to protect each other and take care of each other. So I think I'll just wrap up. Diana, I'd love for you to share any last thoughts you have. But my last question to Dr. Burke Harris would be, where's the best place to get information? I think you acknowledge a little bit right now that things change all the time, and in this world of disinformation or misinformation, what's the best source that we can offer our Boderistas community to tell them, like, check here? I mean, obviously, their own personal doctor or pediatrician is probably going to be at the top of the list, but would love to hear any other recommendations that you may have when it comes to that.
Yeah, my number one is talk to your doctor or your healthcare provider, right? It's someone you can have a conversation with, you can ask questions to, you can all of the above. But the other great places to get trusted information is the CDC. The CDC website has lots of information, and they put out stuff on there. You can follow them on Twitter, and I don't know if they have an Instagram page, but whatever, they have social media. The other, especially for here in California, the California Department of Public Health has a really wonderful website that's really specific to California. So the CDPH website is a really good website. And the other, California has a specific website called covid19.ca.gov. And that's where folks can go to get information about, for example, the rules in your county. What are the rules in your county? What is the data? What's open and what's not open? What should I, what am I supposed to be doing? As well as some of the latest scientific information about how you can care for yourself. And also on that covid19.ca.gov website is the Surgeon General's playbook for stress busting in COVID-19, both for adults and for caregivers and kids. Because the one thing I also want to remind people of is that it's a pandemic. If it feels hard, it's because it's hard. And so we want to care for ourselves, both physically with masking and hand washing and getting vaccinated and all of that stuff, but also emotionally and caring for our emotional and spiritual well-being as well.
I totally agree with you. One of the things that I'll say that I did after I recovered, I was so concerned about the state of my lungs and would they, had they taken a beating with the illness, with the pneumonia. And that's when I started doing this trampoline exercise that was introduced to me by Elsa Collins. And when I saw it, I didn't say, oh, this looks enjoyable. I thought, oh, this is going to regenerate my lungs. This is going to be some good cardio to really whatever. And I'm not a doctor, so I'm like, if there's any flushing, this is going to do it. So I do feel, and also, but what I didn't know that it would do it as well was bring me back just a peace of mind. Because that had left me with my anxiety through the roof. I feared everything. My mortality was even a bigger fear. And I will say that, I'll end this on saying that I did get vaccinated as soon as I was able. My kids are vaccinated, my 19-year-old son, my 16-year-old daughter. And it wasn't something that I even needed to convince them. What they witnessed was enough for them. And it was too close for comfort. So I'm grateful that there is information out there, because there's also a lot of inundating clickbait that will lure us in with fear. There's a lot of headlines that, the 2 things you need to know so you don't die. Or the 2 things that are killing you and all those things. But at least we know now from hearing from you, Dr. Burke Harris, that there are places we can go and at least fact check and see if that, and if we can't find it there, take those questions that you saw online, that you saw when you Googled it, take it to your doctor and double and fact check. So thank you for having me though.
Yeah. And I definitely wanted to just let people know, obviously, that you can also visit myturn.ca.gov or call 1-833-422-4255 to book an appointment or find a walk-in site to get the vaccination. And I know that, for me and my family, we feel very comfortable being able to congregate and have things together in person because we all are vaccinated, and that makes us feel so much safer and genuinely be safer. And one last question I wanted to get in before I then genuinely wrap up is, I hear, I'm hearing on the radio, we're all hear people have conversations about this idea that, well, even if you're vaccinated, you can still get COVID and you can still spread COVID. So then why get vaccinated? And so I'd love for you to kind of just give us a little insight into why you should still get vaccinated and why it's important, and how maybe the difference between someone who's vaccinated and unvaccinated are not actually the same thing, right?
Yeah, so one thing I want to say is that it is true, and I think especially with the Delta variant, because Delta is as much as twice as infectious as the previous variants of COVID-19, it is possible to be infected after being vaccinated, but you're not going to get as sick not near, first of all, you're much less likely to get infected. As I said, folks who are unvaccinated are 8 times as likely to be infected as someone who is vaccinated. But the other thing is the likelihood is that the illness will be quite mild. What we are seeing is that if you are vaccinated and you even somehow end up getting COVID-19, the likelihood is that it's going to be like a cold or a bad cold. It's that the risk of being hospitalized just goes way, way, way down. And certainly the risk of death is like way down. And so that is the big thing. And part of the reason why that's so important is because I think we all remember in December and January where our hospitals were overflowing. We had ambulances that had to be circling the hospital, and even people with heart attacks couldn't get into the emergency room because they were stacked high with people with COVID. Right. And so if you're vaccinated, you're much less likely to get sick. But even if you do get sick, it's much more likely to be quite mild. And that's really important. And that's what we want to avoid, the wondering if you're ever going to see your kids again. Right.
If I could just throw in here, Dr. Burke, I admire and respect greatly what you do. And I love listening to you because you have such an effortless and peaceful way of delivering this information during this pandemic. But on a side note, I often say that you have like this subtle Beyonce fan blowing wind on you that's just it's making it all work. It's like she's smart, she's strong, she's caring, she's loving, and she's beautiful.
That's really kind. I'm actually sitting in my garden, so I've got a little breeze blowing through.
And the breeze is working perfectly with the timing.
You're doing very well. Well, on behalf of Poderistas and the California Department of Health, Diana and Dr. Burke Harris, thank you guys so much for this very honest and transparent conversation about COVID-19 and the vaccines. Thank you guys so much for joining us here at Poderistas. We hope this conversation helped give you information and make you feel great about going to get vaccinated and keeping each other safe. Thank you.